tunapigania training. We have a training guideline that is given to all the counties. We want to be trained according to that training guideline. We want employment. There are HR, there are books that are there on staffing norms. We want people to be employed according to the staffing guidelines. We don't want anything that is outside our mandate, that is outside the constitution. We are not asking for an increment in our salaries. We are only asking promoters. People have not been promoted in the last 10 years. Surely, human beings need motivation. Where does a worker get motivation if not from promotion? Knowing that you have worked well, appraisals are at 100%, but for the past 10 years, there's been no promotion. How can a member continue working? We want promotions, we want trainings, we want employment of other health workers to curb the terrible shortage that we have here.
A clearly frustrated lot there, just outlining the issues that they want addressed by county governments with respect to healthcare. So let's have this conversation about the state of healthcare in the country. Where are we heading? How bad is it? How did we even get here in the first place? We're speaking to Boaz Onchari, who's the chair of Nurses Union here in Nairobi. Sir, thank you for joining us on The Big Story this evening. We also have Dr. Mercy Korir, who is a resident medical reporter. Mercy, thank you for your time. And allow me to begin with you, because this is a conversation I've been having with you the entire day. Anyone looking at what's happening right now with healthcare in the counties, and anyone who has looked at that trajectory, how we got here, specifically 2017 was a very bad year. One would think we didn't learn anything from 2017, did we?
Linda, it looks like that is the case, because that it's not just 2017. The industrial action that really shook the country when it comes to doctors' issues or healthcare workers' issues was in 2011. And in 2011, something was sorted out, but in 2017, it's like all hell broke loose. So we'd expect that the country, and particularly the counties, would have learned something from between 2017 and now, just a short 2 years' time, in which to sort out the human resource issues, whether it is on their staffing and their promotions, as Dr. Gudigor mentioned, or even just their remuneration. We'd expect that between then and now, we would sort out issues so that we don't go back to industrial action. But it looks like either change of governments or we are not getting something right. And to me, Linda, it's symptomatic of a bigger problem with our healthcare system. Remember, the healthcare system is not just the healthcare workforce, but you have other aspects of healthcare that could be or are ailing, and just the industrial actions are just a small sign of what really is ailing the healthcare system in the country. So in my own opinion, from where I sit, I think the country and the people, those who are responsible, have not really learned something, or somebody is not doing what they are supposed to be doing at the counties, Linda.
Boaz Onchari, from a nurse's perspective, so while Sophia was speaking to Dr. Ochanji, he said, I mean, this grandstanding is not going to get us anywhere. There's a complete lack of leadership from where he sits. There lacks a method of engagement between healthcare workers and the county governments that they work for. So from your end, and I know nurses also have had issues with certain counties. I remember a couple of months ago, there were strike notices. At some point, the president also got involved. Where is the problem between healthcare workers and county governments in this country?
Thank you very much for hosting me tonight. I want to start by saying that the worst mistake that we did as a country is to actually, under devolution, health was devolved. That is the worst mistake that we made as a country. Dr. Janchi said clearly that if human resource is taken back to the national government, then we are able to deal away with this issue called strikes. Health workers don't go to strike because they want to be on the streets. What we're demanding for in our CBAs is nothing new. This is something that is obvious. When we're demanding for promotions, when we're demanding for a good working environment, that is not new. But because our leaders and our governors, so to say, they have all the monies and all the resources to seek health care from abroad, that is why they are not taking the health care. serious in our country. So it starts with them. If they're really serious about the health situation in our country, then they should be ready to just honor the CBAs, implement whatever we've discussed, and the issue of strikes will be a thing of the past.
Is that across board, the entire country?
This is across board. And in fact, I'm telling you, and this one you take it to the bank, those strikes are not going to end anytime soon. Because the only language these governors and the country understands is like they understand strikes. Doctors went on strike for 100 days. But to them, it was like, our kids, we are not going to those institutions, so we have nothing to lose. Nurses were out for 151 days. Everything was like, it was usual to them. They forget that in health, it's not like in a mining institution, whereby if those workers in the mining institution go on strike, those minerals will still be there until those guys are back to work, and they'll continue getting the minerals. But in health, when we go on strike, we lose those lives, and you will never reverse them. So it's up to them.
And you know, that is what worries me, because health is not just like any other profession. The minute you guys go on strike, and that is why Sophia was asking, is there another way out? Do we always have to resolve this way? And it's interesting that you're saying the worst mistake probably the country made was devolving healthcare. And that is a conversation that I've had in several different forums in the country. So basically, I'm looking at Kirinyaga, I'm looking at Laikipia. And some of the issues they're raising were the working conditions, and specifically for Kirinyaga, I remember the hospital that was featured all over in the media, and the health workers, they were just saying, give us a better working condition. So from your end, Boaz, is that if the one solution that we can implement right now is take the health function back to the national government, that is the solution for you?
Exactly.
Okay. Again, I did speak to Chair of Governor's Council weekly for Paranya when we were talking about the nurses issue, and he was like, I don't think this is the solution. The problem with the county governments is that county governments are not adequately funded by the national government to be able to achieve this. Mercy Korir, is that a sentiment you agree with, that perhaps we need not to have devolved the healthcare to the county governments?
Linda, there's a Swahili saying that kila mwambangoma huvutia
Mercy,
kwake.
no Swahili. Okay, repeat, what?
Kila mwambangoma huvutia kwake.
What does that mean?
In this instance, well, when you're looking at the healthcare sector, when you talk to the doctors' union, when you talk to the nurses' union or the clinical officers' union or any other union, they will be agitating for the rights of the healthcare workforce, as is their mandate. But I'd like to look at it globally in that, one, healthcare, when it was devolved, and you've had several senators or governors saying, with a devolution of a function, then resources should have followed it. And probably that's why you're saying when you're talking to the chair of the Council of Governors, he had issues that they're not well resourced. And I've had the privilege of working in the counties, and they have issues with funding. So this is, as I said earlier, a global issue which we are supposed to look at from a national level, in that, are we funding our healthcare sector adequately so that human resource, which is a vital part of healthcare sector, is well funded for doctors, nurses, clinical officers, and all other cadres in the healthcare sector to operate well in the healthcare, in the healthcare space or in the hospitals. Two, are we funding our healthcare system adequately so that we have supplies and commodities that adequately run the hospitals? That is why doctors are asking for better working conditions, because there's no point of sending a doctor or a nurse to a hospital and they don't have any gloves, or they have a patient who needs insulin and there's no insulin for them to work on, or the conditions are just not habitable for any patient to be there, because they will come with one infection and they may collect many other infections from the hospital. So are we funding them adequately for us to make sure that that particular aspect of healthcare commodities and supplies is well taken care of? We tend to discuss healthcare from silos, from a human resource only function, from a commodities and supplies only function, or from, you know, these small silos. So we need to look at it holistically. For a hospital to run well, what do you need? Take, for example, a level 4 facility, which is a hospital that should have
the adequate specialists in that facilities. When you pick any level 4 facilities, can they manage all 4 major issues of healthcare? That is, from internal medicine, surgery, pediatrics, and obstetrics. Can they manage it? Do they have an ICU? Do they have an HDU? Are these adequately staffed and manned? If you look at it from that holistic function aspect, yes, then you will be able to run it as a whole unit that one, whether you pay your nurses very well or doctors very well and they don't have the facilities to work with, then your healthcare is compromised. If you're supplying the hospitals, for example, and you don't have the necessary critical care nurses for your ICU, for example, you don't have the anesthesiologist for theater, then what services what services will be offered to your patients, to the clients who come to the facility? So we need to look at it from that holistic perspective. So when we come and discuss the Health Service Commission, then we need to look at it from that particular aspect. If you reverse the human resource only to the national government, what happens to all these other sectors? Then is it better to reverse the whole function to the national government, or is it better to devolve all of it to the county government? So it really needs a more serious discussion than just picking out issues, because we all need healthcare to work for all of us.
Mercy.
Yes.
And that is why the question now is, perhaps, is it time that we reverse the entire thing back to the national government? Looking at what we've been seeing in the county government, it's not working. I mean, Kirinyaga, Laikipia, Kakamega, Kisumu, it's not working. So
when you talk to various people, they will tell you, no, these are teething issues.
How many years down the line, Mercy, teething issues?
Were devolved, so they're having teething issues. Others will tell you it's not working. That's what I'm saying. The duty bearers, the stakeholders really need to come and sit down and have an honest conversation. Let the nurses and the doctors tell you where the gaps are. And if from their perspective, then it's better to devolve the function, you need to listen to people who are actually on the ground. If, for example, the national government thinks, okay, we will adequately finance and resource healthcare so that it works in the counties, these are all the things you need and we are giving you. If it's going to work like that, let it happen like that. But Linda, it's about time that as a country we have an honest conversation about healthcare, because it needs to work for us. While somebody else may afford to go to a foreign country to seek healthcare system, some of us are relying on the healthcare system as is. And even if it's not you personally, you will be involved in fundraisers back in the village or somewhere else to take somebody for health services elsewhere. So we really need to have an honest conversation so that healthcare works for us all. And if we are talking about universal healthcare coverage, it shouldn't be a boardroom discussion. It really needs to go to the ground and an honest conversation with the stakeholders, which is we, the wananchis, who need to give information, input, so that we can organize our healthcare system, not just for now, but even for 50, 100 years to come.
Okay, Boaz, Mercy Korir has just brought in the issue of universal healthcare. It's one of the big four agenda. And there are those individuals who seem to think UHC will be a mirage if what we are seeing in the county governments continues. From a nurse's perspective, from your colleagues, speaking to them, and the experiences you've had in the hospitals, with the current scenario playing itself out in the counties, is UHC achievable? And if not, what should we start fixing now?
UHC is a very noble and good idea.
Okay.
It is something that if our politicians, our leaders take it very serious, it will be beneficial to this country. But as it stands now, it will not see the end of light. Look at the counties that were used to pilot. Why did they choose on them? They may be having their reasons, but from our side, we are looking at those leaders based there. Makueni, the governor has motivated his staff. Promotions have been effected, redesignations have been effected, and at least employment has been done. Look at Machakos. Governor Mutua is doing wonders. Now, I want to give you an example of Nairobi where we're coming in as the other 43 counties that are yet to effect, whereby since devolution, not even a single nurse has ever been promoted. Not even a single nurse since devolution. We went in for a strike. The governor gave us a hearing. We sat on a round table, came up with a plan. In fact, he gave an order to form an executive committee to look into the issues going forward that will not generate into going to strikes. He gave a 14-day ultimatum. Up to now, the chief officer, the CEC are sitting on that report, and yet the CEC was the one chairing that committee. So how do you want us to run away from these strikes? How do you want us to achieve this universal health care when actually the implementers of this baby called universal health care are not motivated? The environment is not favorable for them. So the issue of universal health care is just in print very good, but practicality, it will take time. Yeah.
That would make President Uhuru Kenyatta very miserable. I mean, that was one of the big four he's hoping to achieve before he leaves office in about, 3 years. Mercy, I know all fingers are being pointed at county governments, and I know that both of you agree that perhaps it was a mistake to devolve the health function to the county governments. But then you cannot negate the fact that there's a role that the national government also needs to play to ensure that healthcare works in all the 47 counties. What role is that the national government essentially is supposed to play to ensure that devolved healthcare actually works? I was speaking to Phil, Chair of the Governor's Council, and they were saying, I mean, the national government needs to hold our hand and show us, were you doing this before? It has been given to us. There should be someone showing us the way. This is how you do it.
Linda, one of the main functions of the national government in this shared function of healthcare is on policy. And many people will tell you that our government is probably one that has the best policies, the best guidelines on how to do things. Even when we are talking about staffing levels, when you are talking about what needs to be done, all these documents are there. Our government is always benchmarking with countries, and I've been able to visit some of these countries that they've actually benchmarked. They've had meetings and discussions on how to implement universal healthcare coverage, for example. And my main question usually is, why are we not able to do this? Is it a lack of capacity? Is it a leadership and governance issue? Is it that we are just broke as a country? We are not able to implement all these things? And this takes me back to the conversation, to what I said earlier, that we need to have an honest conversation on healthcare. And one of the issues that I've picked out from most of these countries is that the countries that have been able to achieve universal health coverage have had a well-motivated and well-trained healthcare workforce. Health is a service industry.
Yeah.
Even if you put up 20 radiotherapy centers across the country, if you put up how many chemotherapy centers across the country, if you don't have the well-trained and motivated healthcare workers to work or to offer services to the people, then those will just be monuments. We'll just be pointing and saying we've established this, and yet no services are happening. So a bulk of what really needs to be done, and where I agree with the unions, is that healthcare workforce must be well-trained and well-motivated. And luckily, training is a national government function, that they need to make sure that the country is adequately staffed, all cadres, from doctors all the way to your technicians, either lab technicians or dental technicians. They need to be well-trained. That is one thing. The other thing they need to do is give a formula or a plan, and that's why there's an intergovernmental committee between the national government and the county governments on the staffing, because you need to have equitable distribution of healthcare workers. For example, we know as a country, probably oncology and cancer is one of the discussions that we are having now. We know that we do not have enough of these specialists across the country. So what are we doing to make sure that that person in Turkana who may need cancer services gets the same help or the same consultation or the same whatever they need from the same number of oncologists that we have in the country? Do we have a formula to share
this staff, are they well motivated, for example? In our marginalized areas, what are we doing to incentivize healthcare workers to go there? We know those are harsh conditions. Are we still giving them a risk allowance of 600 shillings, for example, to go work in those marginalized areas, or are we making it conducive for them to go there? And this is probably what the Council of Governors is talking about when they say the national government to hold their hand and work with them. They have these policies. They interact with multinational organizations that give them technical advice from what other countries have done and what can work in this country. Is this really happening, or are we having everyone rooting for their own interest and rooting for their own agenda? And possibly that could be why we are not moving as a country, or we're not moving fast enough to achieve universal health care. And one of the things that maybe I should say is that universal health coverage is not a destination. It is a journey, but we need to see progress. We need to see movement. In 6 months' time, do we even have a report or a brief by the government to show that the pilot, this is what has happened? The doctors will tell you that they had an influx of patients and then they couldn't send them anywhere else because...
Oh yeah, by the way, Mercy, hold on.
Yes?
Is there even a report on the pilot program in the 4 counties?
From where I sit, I haven't seen. All I have is anecdotal reports from different counties on what they've been able to do. And most of them have said they've had an influx of patients coming into the hospital. And it's not just from the pilot counties. They even have from neighboring counties coming in to the hospitals for healthcare. Okay. But then you find that you do not have adequate medicines, for example, adequate commodities to offer all these patients that are seeking services. So somebody, yes, comes to the facility, they are attended to after 6, 12 hours of waiting. Some are told to come back the next day. Is this really what we are aspiring? Is this really what we want as a country when we are talking about universal health coverage? Okay. Is it just to see that we have numbers or to say we are there? Or are we really looking at quality and the outcomes of treatment? This is why I say we need to look at healthcare holistically. Look at the person as a whole and not in silos as what seems to be happening across the country.
So basically what you're saying is we all need to converge somewhere and have a serious conversation starting from point A about healthcare in this country. And
this conversation needs to have been held yesterday for us to go somewhere.
Yeah, because this touches on the lives of people. Boaz, listen, so just listening to you a little earlier on, you're very categorical and you seemed to agree with Ochanji that CBAs have to be implemented. So basically what you're telling Kenyans this evening is that from the nurses' perspective, unless CBAs are implemented in all the 47 counties, this back and forth between medical health workers, specifically nurses, will continue. And the only solution for you, from what you said earlier, is that maybe we need to take back the health function to the national government. So basically you're saying we're not going to have peace until our CBAs are signed, or take us back to the national government. That's it.
Yeah, actually what you're saying is very right, and I want to echo your words. That is actually what we are pushing for. And if, as I said earlier, if our leaders really want us to see our health situation in our country move to the right direction, is not to run away from the challenges that are there. For us to solve a challenge, you have to accept. Look at Kirinyaga. The governor is she's really running away from the situation. Those are facts. Those are not things that someone just woke up one day and said, let us go on the streets. By the time nurses are downing tools, we've tried all sorts of engagements which are anchored within the law, including the last resort, which is the strike. So the best thing that our leaders could do is not to run away from those challenges. If those challenges are tabled, and then be honest with what is achievable, not to give false promises, and implement what has been discussed and agreed, then we'll be moving towards a very correct direction. But as it is, and as our country is, with our politician, we still have a long journey.
And that journey worries me, Mercy, in under a minute, because he's saying they tried everything they could to fix this with the county governments. And that worries me because then I'm forced to think about what sort of engagement is there between health workers and county governments and some of these leaders, because it says, I mean, the Kirinyaga governor basically made a decision and it's not the only one. So what sort of engagement is there, really?
Linda, when you see industrial actions, by the time, as Ochanji had rightly said, by the time doctors or nurses are going on strike, it means all avenues to get an amicable solution have broken down. And this takes me to one of the things that I'd mentioned, that leadership and governance is actually very crucial in the healthcare sector. If there's no proper leadership, if there's no proper governance of these resources in the healthcare sector, then you find that you get industrial actions. And that's why I'd said that when you see strikes, when you see us going back to 2017, then it's a symptom of a bigger problem.
Okay.
And in this case, is it a bigger issue with leadership and governance in those counties, such that they are not able to amicably solve issues that the healthcare workers have raised? Is it that they are not able to implement the CBAs? And if so, what really is the issue? And are they incapacitated, or are they not in a position to solve these problems or address the issues raised in the CBAs that they themselves signed and committed themselves to? So it's an issue of leadership and governance that will probably need to be addressed, even as resourcing financially is addressed. Human resources, the staffing needs are addressed in the county hospitals and the county facilities, and even the commodities and medicines being provided in the facilities.
I need to wrap this up, but just listening to all of you today, it's clear that perhaps the Health Cabinet Secretary, Cecily Kariuki, and indeed President Uhuru Kenyatta is one of the big four agenda, universal healthcare. Maybe people need to converge somewhere and start having a serious conversation about the state of health in the Republic of Kenya. And that is where we leave it here on The Big Story. A big thank you to all of you who've been part of this conversation. I'm Linda Ogutu.